Right, so this is diabetes. This is your blood.
Mm-hmm.
And inside your blood is sugar. These circles represent sugar, and it's normal. We all have sugar in our blood because normally our muscles and our tissues use sugar for energy. And normally what happens is our body makes insulin. And insulin's job is to carry the sugar from the blood into the muscle. So insulin keeps both sides in balance. Insulin comes from our pancreas. And when we eat, the pancreas releases more insulin. Sugar gets into our blood from our stomach. And depending on what we eat, the more carbohydrates and sugar we eat, the more sugar comes in. And our liver makes and releases its own sugar. So if we're not eating, we don't starve to death, our liver can make and release its own sugar. When someone has diabetes, there's a problem with insulin. Either our pancreas is not making enough of it, or the bigger problem is called insulin resistance. Insulin resistance happens when the muscles and the insulin don't connect properly. It's like a traffic jam. The sugar tries to leave the blood, but it leaves too slowly, and the sugar stays in the blood too long. When sugar stays in the blood too long, it damages the linings of our blood vessels. So the longer you've had diabetes and the higher your blood sugars have been, the more likely you are to have damage to your blood vessels. And this damage affects every part of your body. Diabetes is the leading cause of blindness, kidney failure, and limb amputations. So you get infections in your toes that won't heal, and then they have to end up amputating your toes, and then your legs, and so forth. Diabetes is also a big risk factor for heart disease. So we treat diabetes with food. The less sugar you eat, the less sugar goes into your blood. We treat diabetes with exercise. Exercise lowers insulin resistance by allowing your insulin to work better. Your muscles and your insulin connect, which helps pull sugar out of your blood. And then there's medicines. We can give medicines that you take by mouth that affect your pancreas, your liver, that decrease the amount of sugar your body absorbs, helps to reduce the insulin resistance. One of the medicines we have is Bydureon. It's a new medicine you give once a week that does 4 different things. When you eat, it helps your body to make more insulin. It helps you to it reduces the amount of sugar the liver makes. So it reduces the liver sugar. It slows the stomach. So when you eat sugar, when you're diabetic, the sugar comes into your bloodstream very quickly. But when you take this medicine, Bydureon, the stomach goes more slowly. When the sugar gets in the blood more slowly, your body can process it better. And the last thing the medicine does is tell your brain that you're full. So if your brain thinks you're full, you won't eat as much. And that'll help you to decrease your weight. And obviously it helps you decrease your blood sugar, which helps to treat your diabetes.